For me, being named to Castle Connolly Top Doctor is a major honor. First of all, it's peer nominated, and secondly, to be recognized as one of a very select group of AAPI physicians is beyond what words can express in terms of gratitude. So very honored and very humbled by this award. I think what makes Castle Connolly Awards so special, especially this AAPI award so special, is that it is peer nominated. It's wonderful. Just today I had a patient come and hug me and say, "You changed my life, thank you for saving me." It's amazing to have patients do that, but it's a whole other level also of having other physicians and other clinicians acknowledge you as one of the best in the field. I originally decided to become a physician actually when I was a lot younger. So I always loved the math and sciences. And unfortunately, I was sick a lot as a child. And so being in and out of the hospital system and the doctor, I really got to understand what it was like on the other side to be a patient. So I realized after doing that I genuinely want to go out there and help people, and because I know how it felt and I know I can make a difference. And I gravitated towards allergy and immunology, first of all, because I loved the adult and pediatric population. And I realized allergy immunology is a lot about preventative medicine. So our goal is to prevent you from getting sick, prevent you from damaging your tissue. And it's really unique in the sense of, for me, it's gratifying because I can see babies, like just the other day I had a baby all the way up to somebody in their 90s. And so it's a diverse patient population. And not only that, I'm also seeing parents, grandparents, cousins, aunts, uncles, kids. So it's very rewarding for me to be able to see someone as part of their whole family unit and form a long-term relationship with them. I believe that my background as an Asian physician heavily contributes to the quality of care that I'm providing, in the sense of my parents were here to watch me receive this award today. So my parents, worked so hard as first-generation immigrants, as many immigrants do coming from other countries, and really worked multiple jobs and saved every penny to try to get me through school and to be able to go to college, as I'm the first physician in the family. So this was a huge, huge deal for myself and my family. But in addition to that, I think it changed my perspective on how I provide care, because I realized how important diversity is. And it's that importance on diversity that drives how I take care of patients on a daily basis, because I try to approach it from what their cultural expectations and their cultural norms are. In addition, even for staffing for our office, I have staffed it with a very diverse, with men, women, African American, Hispanic, Asian, Ukrainian. I really have the gamut in the staff, so that we can provide a more holistic and a more comprehensive way to care for the patient. Definitely we see quite a bit in the AAPI community in terms of health needs. One of the first things that we see is difficulty in representation in terms of clinical research studies. So the hard part is trying to get, we have these medications and we have these things come out, and but if you look at majority of the studies, they're majority Caucasian. So trying to get that representation from the Asian American population to say, hey, how do these medications affect us? How is it going to work in our bodies compared to someone else? Now, some of the places that have been studied, especially for Southeast Asians, is like cardiac outcomes. And if I really delve into my own field, which is allergy and immunology, for us, what we're looking at is the food allergy and what's going on. So what we noticed is in some of the Asian countries, the incidence of food allergy is, definitely a half to a third compared to living in a developed country such as the US or Australia, and trying to figure out why is there that discrepancy and what's going on different that's happening when these patients are in this country, and what can we do to change and to have better outcomes so that these children don't develop food allergy and don't become food allergic adults. How I perceive what's going on with diversity and inclusion is finally that we're seeing a more of a focus, and especially more outcomes being researched. So myself, I participated in a research study where we were looking at the outcomes of various technologies in the diverse population, and how to make it more accessible for these different populations that may not have had access to these things, such as maybe they don't have access to the telephone, or maybe they a smartphone, or maybe they don't have access to computers where they could log on and put in data as easily as somebody else could, where we're doing some type of remote monitoring. So being able to have the technology and have the services is one thing, but being able for that patient to be able to utilize effectively that technology is a whole different ball of wax. And for me, I'm very into remote patient monitoring, remote therapeutics. So where I would like to see more research being done is, okay, if we utilize these devices and we're able to get this to all types of population, including the Asian population, is there a way that I could drive down the numbers in terms of less asthma exacerbations, maybe better cost utilization in terms of less biologic use, and overall less hospitalizations and steroid use by my asthmatics? How do I see AI in my practice is definitely like starting with my practice, and then we'll go big picture. But starting in my practice, we're already utilizing AI in terms of utilizing AI for prior authorizations, to be able to generate letters, generate links, auto-populate certain fields, to be able to figure out like what the failed meds were, what are other things that we had done in the practice, so that I can get the approval of the medication easier. The other way is currently there's a couple of different ways to utilize AI in terms of using sound technology to be able to listen to what you're saying in the room, so that we can be more efficient and be more forward-facing with the patient, because that is a lot of the complaint that we're constantly typing into the computer. And luckily for me, I took a typing class when I was a kid, so I can still look at you while I'm doing my note. But for a lot of people, this tends to be a struggle, and patients feel like it's disengaging. And then lastly, we're using kind of like smart, it's almost like smart tabs, like where you have a smart diagnosis, and everything that we've ordered under that diagnosis in the past can pop up for us, so that we know what types of things we can use. So if we order certain labs, certain meds, these are going to be easy for us to access, to be able to make the visit more efficient, and also help the patient understand things, because we've been able to pre-create that education module for them. So for me, that is where AI currently has been in the clinic. But where I see AI going, I see growing by leaps and bounds, right? So us being able to use the education and have education at our fingertips, give answers, trying to again feed our EMR with some of this rich data as to what the patient has done before, and pre-populate some of our prior auth requirements, I think is going to be a huge thing for physicians going in the future. I feel like being a patient in the office is like being one of the family. So you're coming in, and some of our receptionists have been here over 30 years. I have a nurse who's been in the allergy immunology field over 40 some years. So you're coming in here with people who are learning their craft in terms of they are trying to go to nursing school or PA school or medical school, but you also have staff that has learned and honed in their craft, and they genuinely will go the extra mile to take care of you. We feel as an allergist, our job is more to educate you and to try to be a part of preventative care. So when you're coming in, a lot of times I feel like when patients have come in, there's two things. One is you've been in the passenger seat, right? I want you to get into the driver's seat of your health. You're not just riding along. I'm not just giving you medicine to kind of block the symptoms. What I'm doing is trying to change your lifestyle, and that's why I call ourselves a wellness center, right? It's wellness from top to bottom. So I'm trying to integrate not only are some of the habits you're doing, maybe using medication, maybe using something more holistic. And by doing some of the testing, which we do some spirometry, some skin testing, pheno testing, and sometimes we have breath testing or labs that we might add in, but utilizing whatever testing we need to find the best solution for you in terms of preventative health management. And then also doing our job to educate you and have my nurses and MAs come in and reinforce that education that I just did, because I know that the first time you come in, the experience can be extremely overwhelming, because you might think, well, that's just normal for me. And I'm telling you, no, you don't have to live like that. So that's a completely different feeling that you may not have been used to. And I think that is what keeps patients coming back. It's that warmth, it's that family feel, and it's that focus on them and education, because when you're here, you are my number one priority. Even if I'm running behind, whatever happens, you are my number one priority, and I'm going to stick with you from the beginning all the way until you're better at the end, and are sending me Christmas cards once you're all healed and better. So for me, my passion projects include a lot of volunteerism. So I do believe in advocating for my fellow allergists and immunologists, as well as advocating in medicine, and best of yet, advocating for my patients. So I remember when I was past president of the Illinois Society of Allergy, we worked hard to get epinephrine into the schools so that everyone could have access to epinephrine, because you never know when the first time is that that child is going to have a severe allergic reaction. The other thing would be, I would say, like, also advocacy on a federal level in terms of trying to help my fellow physicians to try to minimize that prior authorization project. So in terms of if a patient really needs a medication and they are trying, we're going through 6, 7 different medications and the pharmacy isn't filling anything, that's incredibly frustrating. So trying to streamline that and trying to be proactive and working with Capitol Hill to try to make some changes in that direction, I think is very rewarding for me, and hopefully rewarding for my fellow physicians as well as for patients alike.